Hello, thank you for choosing Saraji Health. My name is Anna Williams Martin. I am the clinician here with Saraji Health, and I will be showing you how to do your self-administering of the GLP medication. Okay, now very simple. You will get the medication in a package like this. Okay, you also get the medication. It's going to be coming. You will get it here in this container. It will look like this. Here is what they call a vial, and this is the cap. So before you do anything, I want you to ensure that you wash your hands. First thing is to wash your hands and maintain a clean environment, a sterile environment. You want to gather all your medication that is prescribed for you. You want to ensure that you have a clean syringe, alcohol swab, and of course, like I restated before, the medication. Okay, so once you wash your hands, set up your station, you're going to follow the instructions. For example, it tells you here to take, for example, say whether it's 50 units or 25 units. But I want you to know that this syringe here is a 1 milliliter syringe. It contains 100 units. Okay, so when you look on the syringe, it will say units. And if you want to know, based on the medication, you'll see ml here on the bottle. This is equivalent to 1 ml. Okay, again, 100 units equivalent to 1 ml. So you are going to follow the instruction as prescribed by your provider to take exactly that amount. So what are you going to do? You're going to get the vial. You're going to use your finger and just flip off the top. Okay, and then it will be like this. Then you're going to open your alcohol swab and then you're going to clean. Okay, let it air dry for about, say, 10 seconds. Okay, while you're doing that, here is the bottom part of the syringe, which is the plunger. You want to remove the cap here. Very simple, remove the cap. Also, too, you're going to remove the cap of the needle, where this is a needle. So this is about dry. Then in here, you're going to have a little air. Okay, so you're going to insert a little air into the vial, which is right here. Okay, what that does, prevent air from coming back into the syringe. Then you're going to gently invert the vial, and then you're going to pull back on the plunger. Okay, so I'm going to take up 50 units. Okay, so you can see. Okay, take a little bit more and push back to get rid of the excess air from the syringe. Here you have it. Once you pull the medication into the syringe, you can allow it to sit for 10 to 15 minutes, okay, to let it, reach room temperature. Because when it's cold, when you administer cold medication, it can create skin irritation, redness. So you want to also make it sting. So you don't want it to experience that discomfort. So you want to allow it to sit for 10 to 15 minutes, okay, before you administer it. So how do you administer it now? So it says subcutaneous, and what subcutaneous means simply, it's just the fatty tissue layer between your skin and your muscle. So where do you administer this medication? It's going to go in the back of your arm where there is the adipose tissue, okay, or the front part of your thighs where there's adipose tissue, or around your love handles, And then you're going between your thumb and your index finger, you're going to bunch for 1 centimeter. You do not squeeze. And then you administer the medication slowly, and you want to take the needle out immediately. Usually, when you're in a hospital environment or healthcare setting environment, the proper thing to do is never to recap a needle, okay? And then you dispose it into the sharp container. But since you're at your home environment, you may not have a sharps container. What you're going to do after you finish with the syringe, you're going to safely recap it, okay? Or you want to just bend the needle and put the cap on it, put it into a plastic bottle. You want to make sure that's sealed or wrap it into a plastic so no one can accidentally get stuck by it, okay? That's safety. Thank you for choosing Saraji Health. And if you have any questions or concern, please feel free to reach us at sarajihealth.com, or you can email us at sarajihealth@gmail.com. Thank you.